Pinhole surgical technique is a technique that's used in lieu of traditional gum grafting. And what's done is we place a small pinhole type incision in the gum tissue way above where the actual gum line is, and we use special instruments that are used to pull the gum tissue down. After we've done that, we place little collagen strips into the area of the pinhole, and that holds the tissue down in the new position, which usually has covered up areas of recession. In places where the pinhole surgical technique can be used, the advantage of the pinhole surgical technique is that the recovery tends to be much easier for the patient because there's no second surgical site on the palate. Also, the recovery tends to be very quick because the pinhole heals up very, very quickly. Patient does have to kind of baby the area for a little bit longer than they would with a traditional grafting technique. But from a patient perspective, you get a much quicker, more comfortable healing oftentimes from this type of procedure. There's no sutures that are utilized, so patients aren't going to sit there and play with sutures with their tongue or anything like that. The largest benefit of the pinhole surgical technique obviously is not having to go to the palate for the graft. That's what most patients would think of as the biggest benefit. I will tell you one of the other huge benefits though is for a person who has multiple areas in their mouth that have gum recession, we're limited when we utilize a patient's own tissue for grafting and how many teeth we can treat at any one time. With the pinhole surgical technique, we can treat a full arch or even a full mouth at one surgical appointment per patient.